I'm Margaret Hoover, and we're here day 2, Women in the World Conference, and we are joined by 2 participants from the big stage who just finished an incredible panel on maternal mortality. Soledad O'Brien, who was the moderator of the last conversation, and JoAnne Fischer, who is the CEO of Maternity Care Coalition. We're going to continue the conversation, but first, Soledad, what was your impression of the panel? Is there anything that surprised you about it?
Yeah, you know what I found most shocking is just how horrifically bad the United States is on maternal health. An issue, before I started doing any research, I would have thought, hey, we're up there. We're probably maybe number 2, maybe number 3 in the world in greatness on maternal health. We're actually, there are 49 countries that do it better than we do. And so that was really stunning. And I think when you look at women like JoAnne and others who are really leading on the ground and trying to close that gap and change those numbers, it's a real fight.
I mean, that was the thing that was so extraordinary about the panel. For those who didn't see the panel, is that the first part of the panel focused on the international numbers, and we know 300,000 women die every year, 1 every 2 minutes, and that was international. And then it went to the domestic side of this, and shocking numbers, as you were saying, 49 of women are dying in the United States, or almost dying because of lack of health care and maternal care.
And that those numbers have doubled in the last 20 years, so that while the rates are going down in the developing world, here they're increasing.
How long have you been involved in this issue?
I've been the director of the Maternity Care Coalition for 25 years, and before that worked at a maternity hospital, so quite a long time.
So what are some of the things that you're focusing on to help drive down those numbers?
We have a community health worker program in Philadelphia, and as a result of this Merck for Mothers initiative, we've done a little variation on our Mommobile theme and have what we call the Safe Start Mommobile. And our staff are doulas, and they are patient navigators, and they continue to help low-income, pregnant, and very isolated pregnant and parenting women adjust to early parenting and navigate the pregnancy. But in addition, now we really are doing translation, kind of both literally and figuratively, so that we can reinforce the messages that their physicians or midwives are giving them. On the other hand, we're dealing with the issues that their healthcare providers aren't so good at dealing with. Things like domestic violence, things like the stress of living your life every day as a poor woman.
What are the biggest challenges? One of the things that you highlighted in the international panel, and that really came out, is that a lot of the women who end up dying are women who left 5 days ago, and they arrive at the clinic too late. Do we have the same problem in the United States, where women aren't getting care throughout their pregnancy, and so they're showing up and it's too late?
It sounded like there was sort of a metaphorically, yes, right? They haven't gotten health care through
words,
their entire childhood. So it's not a 5-day journey to the hospital, but it is sort of the journey through their life as a poor person. They're not getting any of the medical treatment that they should be getting. That's part of the reason you see these numbers that really should be, year after year, going down. They're increasing.
And I think with health reform, we may see how there may be some changes, but for many women, the first time they're eligible for Medicaid is when they're pregnant. So that's when they first hit the system. And then often they are ineligible 8 weeks after they have the baby. So it doesn't really support that ongoing care in between pregnancies that really can get women healthy and prepared.
And that can be preventative. Was it surprising to you the fact that Merck has had on this? I mean, it sounds like Merck as a company is really sort of leveraging their corporate power in a good way.
Ken and I spent a lot of time sort of backstage, and he said, the thing that really gets him is it's so fixable. These are preventable deaths. These are not the, well, who knew and we didn't know what was going to happen. These are the deaths that you actually could have prevented with really simple measures. And so I think that's the thing that's very frustrating, that I think that really correlates to Ken's passion for it as the CEO of Merck. I think he feels like this is a fixable problem, and when it's fixable, then let's dive in and make a difference. One thing JoAnne said when we were wrapping up the panel, she said, this is the first time people have talked about the mothers, and it's really true. Usually, right, we talk about infant death, the death of the babies as the mother is in labor. And very rarely do we even care about the mothers who die. But a mother dies, that throws the entire equation of a family that's intact and able to survive, into chaos. It means the oldest daughter suddenly leaves school and her life has changed. And so I think it's so interesting that the conversation has opened, right, to include women.
Absolutely. And even when we talk about healthcare disparities, infant mortality comes out first because a baby, an African American baby is twice as likely to die in the first year as a white baby. But with maternal mortality, it's 3 to 4 times. So in terms of disparities, it's even greater.
And those disparities, the cause of death for the mothers is, you mentioned right before we started, there's depression, there's violence, there's domestic violence. What are the other challenges?
The other ones are preeclampsia, excessive bleeding. They're the more traditional medical ones. But I think people often forget about those other ones, like homicide, suicide, serious mental health problems, depression.
How can this program scale? Can Merck, not to put Merck on the spot, can Merck do more? or is there room for growth? What are the plans for your organization in the coming year?
Well, right now there's 4 domestic partners that Merck is supporting and through a pilot phase, and we hopefully will all be funded for an implementation phase. But clearly there's a lot to learn, but to really transform this, it is working with the individual women, but it's also the system. So I think we need to make sure that these interventions include this kind of public education, advocacy, so we have policies that really support women getting the care they need.
Well, perhaps a new documentary for Soledad.
It would be phenomenal, right? Because ultimately what makes a good documentary is a sort of a life and death struggle, and this is it. This is the life and death struggle for the infant, for the mother, and really how you change communities for the worse if the mother dies, and for the better if you're able to save lives.
Extraordinary. Well, thank you both for being
My
at Women in the
pleasure.
World. Thank you for coming and
so
talking.
much.
And there we are, Toyota Solutions Studio, Soledad O'Brien and JoAnne Fischer. Thanks both for being here.
Pleasure.